Hi, I'm Dr. Andrew Dickens. I run this Dayspring Cancer Clinic in Scottsdale, Arizona, and I was asked to do a short presentation on how to use the pendulum with CellSonic. Now, the first thing I like to talk about is what are we measuring when we're measuring with a pendulum? Here I have a compass. Now, I can't tell which way is magnetic north without a compass. Obviously, there are birds and mammals that can tell which way is magnetic north. So it's one thing that is a subtle energy. Another thing is using a battery so when we have a battery and we're measuring the battery, there's energy coming off the battery. Well, it's a 9-volt, and you touch your tongue to it, children, you'll get something, but you get a different reading whether you're going to do the plus or the minus end. So what we're measuring when we're using a pendulum is the bioelectric field. Think about it. When they put leads on the scalp for an EEG or leads on the chest for an EKG, what they're measuring is a field. It doesn't stop at the skin no more than a magnet is stopped by a piece of paper. It's a field that goes out. And that's what we're measuring with a pendulum. We're measuring the bioelectric field. Now, I learned about how to use a pendulum from Dr. Jerry Tennant, a medical doctor in the Dallas, Texas area. And what I like to use and what I learned from Dr. Tennant is an acrylic pendulum. There's different styles. There's gemstones, there's crystals, there's a lot of different types of pendulums. I like the acrylic ones. They're light. I've dropped it 3 or 4 times. It doesn't break. It's very quick in how it measures. And when I'm measuring somebody, what I'm doing is I'm taking 2 fingers to go into their bioenergetic field. Now, all the fingers have a different charge, so if I put 2 together, I have a plus and a minus together, so that's a neutral charge. Some people just like to put the pendulum and use the pendulum without using fingers. That's a different style. I don't do that. But many times I might have somebody sitting in a chair and I'll put in 2 fingers. And if it's a female, or a male, I always start at the top, and Jerry Tennant has called these bioenergetic points. So this would be gallbladder, sympathetic, large intestine, small intestine, stomach, bladder, and liver. So I'm telling the woman, I'm not going to touch you, and I measure. I'm not going to touch you. And so when I'm getting down the pelvic area, they understand I'm not going to touch them and everything's good. And then on the reverse, on the posterior side of the body, at C1, that is parasympathetic, an enormously significant point to measure. And then C7 is going to be lung, T5 is heart, L11 is spleen, pancreas, T11 is spleen, pancreas, L2 is kidney. And I always measure left and right kidney because the kidneys can be like a bicycle built for 2. One side's pulling all the weight and the other side's got its feet up going for a ride. So always measure both sides of the kidney. So when I'm actually getting ready to treat somebody, and let's say we're going to treat the liver because that is showing something that's not normal. And what's normal, abnormal? If something's normal, it will have a clockwise spin. As you're looking down on the pendulum, it's a clockwise spin. Abnormal is counterclockwise. Clockwise is like a tornado in the northern hemisphere. All of that collection of energy comes to a point, and that is where the power is. Counterclockwise is a dissipation of energy. You might remember the port in Beirut that blew up a number of years ago, and the videos was this brown wave, the shock wave going out. And once that wave was passed, it was done. There was nothing left. And so what we want to do when we're measuring a system, an organ system in the human body, we want to always see a clockwise spin. That's normal. So if something's counterclockwise, that's abnormal. So what I'll do is typical CellSonic protocol, ultrasound gel, plastic saran wrap over the shock head for sterility between patients. And I'll start off at maybe 50 or 100 shocks for power, and then I'll move up, maybe getting up to 250 shocks, or if it's, I deal a lot with cancer, and so I can go and do 500 shocks at a time. But after each segment, each segment of 250 shocks or 500, I'll always stop and measure, gives the patient a breathing time, and then I get to assess. So if I'm assessing with the pendulum is going counterclockwise, I haven't made the grade yet. And at some point, it might be that the pendulum is just swinging back and forth. That means we're in a neutral zone, I'm making progress, I still need to do some more shocks. But when I hit a clockwise spin, that's enough, and I stop. One thing I want to say is when I'm doing assessment, all I'm doing is I'm holding the pendulum in my hand and I let it go. I'm not trying to put a spin on it. I'm not preloading what I want. I let it go and let it be neutral back and forth, and then the pendulum will pick up on the bioelectric field of the human body and do its thing. And then more information, more CellSonic type thing. I might treat 3 times a week. I might treat every other week. It depends on the patient, and you as a practitioner need to figure out the frequency and intensity and number of shocks, but you always want to give enough shocks to find that clockwise spin. When you've got that, you've done a great job, and I'd like to thank Andrew Haig for the invitation to speak on a pendulum, and I'd also like to thank Andrew Haig for bringing such a wonderful piece of equipment as CellSonic out, and has helped me tremendously in my practice, and I'm sure it has in you. So many thanks, Andrew and Andrew's team. So thank you.